Here are 5 deadliest diseases that can kill your dog. 1. Distemper in dogs. Canine distemper is the first illness on the list. It is a highly contagious viral illness that can be caught by touching contaminated objects, like toys and shared meal bowls, or by being exposed to airborne bacteria. Canine distemper is sometimes known as hard pat disease because it causes the dog's foot pads and nose to become harder. This disease is more likely to strike puppies. This disease's symptoms include teary eyes, throwing up, paralysis, coughing, and high temperature. Canine distemper is a deadly illness for which there is no appropriate medical care. Vaccination is the greatest approach to keep your dog from contracting this illness. It's important to keep your puppy away from dogs that are infected. Veterinarians treat unvaccinated dogs for this illness by maintaining their bodily fluids and provide supportive treatment to avoid secondary infection. The likelihood of recovery is quite slim though. 2. Parvo or canine parvovirus. Dogs who are not vaccinated against parvo have a 91% fatality rate from this highly contagious viral disease. A diseased dog's feces are the means by which it is spread. Carnivore protoparvovirus 1 is the cause of parvo, and once it infects a dog, it targets its internal organs. Typical signs and symptoms include of high temperature, loss of weight, sluggishness, lack of water, and throwing up. Since the virus is difficult to eradicate, veterinarians choose to treat sick dogs prophylactically, keeping their bodily fluids and electrolytes stable. The best defense against infection for your dog is vaccination and good dental hygiene. 3. Heartworm. Heartworms are a parasitic disease that is spread through mosquito bites. The medical name for this disease is Dirofilaria immitis. Heartworms are small parasites that attack the heart, blood vessels, and lungs of an infected dog. There is no vaccination for this disease, however. It can be prevented by administering heartworm medication and injecting the dog with melarsoline injections. Symptoms of this disease include weight loss, heart disease, coughing, lethargy, and respiratory issues. Regular checkups and annual blood tests, administering pills, and shots are the best way to prevent your dog from developing this dangerous disease. The larvae of the parasite take 6 months to develop. Hence, if they can be intercepted at an initial stage, they can be treated effectively. 4. Heat stroke. There is a significant risk of heat stroke in warm, humid weather. Keep in mind that your dog is typically warmer than you and that they always have on a fur coat. For a dog, a temperature that appears somewhat warm to humans may be excessively warm. Your dog may die from the heat if they attend dog events, as they are frequently playful and energetic. On warm days, never leave your pet in the car. You can find an automobile that is overly hot on a 70 degrees Fahrenheit day. Short-nosed breeds, pugs, Boston Terriers, boxers, bulldogs, etc., don't pant as well as breeds with normal-length noses, which makes them more vulnerable to heat stroke and breathing issues. Symptoms of heat stroke includes excessive salivation and panting, anxiety and weakness, unusual gum color, such as a deeper red or even purple, collapse, and death. When a dog exhibits symptoms of heat stroke, it should be brought to a cool, shady place right once. Cold, damp towels should be used, and they should be wrung out and re-wetted every few minutes. It can also be helpful to run cool water over the dog's body and wipe it off rapidly, allowing the water to absorb the heat from the skin and then swiftly evaporate. Heat stroke can turn fatal very quickly, so take the dog to the clinic right away. 5. Rabies. Canine rabies infections that can be fatal. A prevalent sickness in dogs is rabies. It is brought on by a virus that is transferred by an infected animal's bite or saliva. It results in brain inflammation. The deadly disease rabies has a gradual onset of symptoms. Among the signs of rabies are pain, hyperactivity, fever, tingling feeling, and smoldering the injury. Humans are at risk from rabies because the disease can be spread from infected animals by humans who come into touch with an infected dog's saliva. Every year, 56,000 people die from rabies. The best defense against rabies for your dog is vaccination.